Gestational diabetes is an example of a condition or a circumstance that's kind of over-dramatised in terms of the impact that it might have on a pregnancy. So it's very true to say that people who come into pregnancy with pre-existing diabetes, long-standing diabetes, often bring with them significant health problems associated with that long-standing diabetes, and those pregnancies are very, very high-risk pregnancies. The sorts of things we were talking about before with closer supervision both of mums, because diabetic control and keeping sugar levels normal can be really difficult in pregnancy, but also in terms of significant fetal risks, risks for babies in the womb in terms of placenta not working well and things like that. So we do have a higher level of surveillance for those pregnancies. But gestational diabetes is a very different kettle of fish, right? So gestational diabetes is someone who had no or very minimal insulin resistance problems before they got pregnant, but the hormones produced by the placenta increase insulin resistance as a normal physiological thing. So every single woman has more insulin resistance during pregnancy than before she was pregnant. But for a proportion of those, it goes a little bit too far, and that's when we label people as having gestational diabetes. Okay. And the main issues with gestational diabetes are things like babies being overgrown because they're getting exposed to too much sugar in the womb. And that can make them, of course, difficult to deliver. So there's higher caesarean section rates, but there's also higher rates of maternal perineal trauma, for instance, tears and episiotomies and instrumental deliveries and those sorts of things. But the other thing is that babies that have been used to very high sugar levels set their own hormones at a level to cope with that. And then all of a sudden they're removed from that sugar fix, if you like, by cutting the umbilical cord, and so they're not getting that high level of sugar anymore, but they've still got their high hormone levels, and that takes a little while to wind down.